Hello there, Dr. Robert here, Senior Lecturer at the College of Complementary Medicine and Senior Faculty person with the Transpersonal. I've been asked a fair bit about the Transpersonal Therapy. Like, what is it? What is it that actually differentiates it from so-called normal therapies? So I thought I'd outline a number of different areas that I think really stands it apart from conventional ways that we have of looking at psychological approaches. Now, let me begin with this. Transpersonal therapy stands apart. It stands apart from many conventional psychological approaches because it explicitly includes the spiritual, existential, and transcendent, there's that word, transcendent dimensions of human experience. Well, how does it do that? Okay, let's have a look at this. So, inclusion of spiritual experience as legitimate. Unlike many mainstream therapies, cognitive behavior therapy or psychoanalysis, transpersonal therapy treats spiritual experiences such as unity, awe, or mystical states not as pathology, but as potentially healthy and meaningful. Experiences of transcendence are explored, not reduced. Spiritual crises, spiritual emergencies, are supported rather than suppressed. There's an expanded model of the self. So transpersonal therapy moves beyond the ego-centered and centric model of psychology. Traditional therapies often focus on strengthening the ego, and that's quite legitimate. However, transpersonal approaches include the idea of a higher self, or a deeper self, or expanded consciousness. This perspective is influenced by thinkers such as Carl Jung and Abraham Maslow, who explored self-actualization and beyond. 3. Use of altered states of consciousness. Transpersonal therapy may intentionally work with altered states as part of healing. Techniques can include breathwork, meditation, visualisation, and creative processes. These states are seen as gateways to insight and integration rather than symptoms to eliminate. This contrasts with conventional approaches that aim to stabilise and normalise consciousness. There's a focus within on meaning, purpose, and transcendence. While many therapies focus on symptom reduction, legitimately, transpersonal therapy asks deeper questions as well, such as, why am I here? Why am I here in this life? What is my purpose? And how do I relate to something greater than myself? It aligns in part with existential therapy, but goes beyond by including mystical and transcendent dimensions, not philosophical ones. Integration of ancient wisdom traditions. Transpersonal therapy draws from spiritual traditions worldwide, such as Buddhism, yoga philosophy, and indigenous practices, and integrates them with modern psychology. Meditation, mandalas, ritual, and symbolic work are often included. Healing is seen as involving the mind, the body, the psyche, and spirit. In essence, transpersonal therapy doesn't just aim to help you function better, although it does that. It helps to help you transform, reconnect with meaning, and experience a deeper sense of wholeness. A deeper sense of wholeness. Transpersonal Art Therapy. It's much less about making art and more about creating a bridge between inner experience and conscious awareness. Creating a bridge between inner experience and conscious awareness. In practice, it works by engaging symbolic, imaginal and embodied processes, allowing what is often pre-verbal, unconscious or even spiritual in nature to take form. It uses a projective method, but rather than diagnosing or interpreting in a fixed way, it invites a dialogue between the person and the image that emerges. Just want to go back a little bit here into the diagnosing or interpreting from the therapist position. We do not do that. We do not do that. We do not impose upon the person our interpretations of them. We do not impose upon the person our interpretations on the art that comes from them. It's a very different approach than thinking or believing somehow that we as a therapist know their life and what is moving them and the part of the story that they're involved in better than they do. We don't. We do not. We can assist in facilitating them finding meaning out of whatever's going on in their life. So one of the principles that we hold to be true in transpersonal art therapy is the principle that there is a self-actualizing process going on within whoever we're seeing. And we, as therapists, do not want to get in the way of that by imposing our thoughts or our interpretations upon the client, upon the person. In fact, we want to get out of the way of that as much as possible. It's their life. So we might engage in a process where it's a meditation and visualization, where the person's saying that they feel powerless in their life, overwhelmed by life. Now we know as therapists and through our own practice that that is not uncommon to us as well at times. But we also know through the transpersonal that there is a wiseness within them, as in within us. So you might engage in a visualization, a healing symbol visualization, and invite them in to breathing with that intention of finding their healing symbol, their healing symbol. Invite them to relax and to breathe deeper than they would normally breathe. And breathe longer on the out-breath and the in-breath to invite the rest and relax state. And then invite them to go to a place in nature that they feel really safe and secure. And invite them when they're there to feel the earth, to smell the sense of that place, to really place themselves there. What are the sounds, the sense, the feel, the textures of that place? And then discover a new pathway and begin to walk it. And find themselves coming to an open space. Whatever that is for them. And there'll be a waterway there. Again, whatever presents itself in their imagery. And to walk or to move towards that waterway or that water. And to feel the water once they're there in their hands. And then something in them when the time is right for them to reach into the water and pull out something from the water that represents their healing power, object or symbol. And to give thanks in whatever way is right for them. And remember this place. And to begin the journey back along the path that brought them there. Back to the place of safety and security in nature. And bringing with them the symbol or object that's gifted to them from the deeper aspects of themselves. And then slowly to come back to their embodied self. And to tap themselves and ground themselves back into this material embodied way. And then to draw with crayons, with paint, whatever medium they have there, their journey. And allow time for that. Maybe 10, 15 or 20 minutes. And then to ask them to share whatever they want to share about their experience. Again, to ground it back into this material from the internal to the external. And we might encourage them to look after the art, to keep it as a sacred object, or to take it into ceremony in some way. And give thanks in whatever way will complete, for now, the session.